I am going to demonstrate the use of a product for positioning a patient on the operating room table for hip surgery, mostly hip replacement surgery. The product that we are going to review is called the hipGRIP 2. It is a new design of a previous device called the hipGRIP. So what I'm going to do is briefly show you the parts that are in it. I'm going to place it on the operating table without a patient and then with a patient, and hopefully this will allow you, the orthopedic surgeon, to appropriately place your patient in a very deliberate and solid fashion on the operating table for your hip surgery. So the principle of the hipGRIP 2 is to support the patient's pelvis anteriorly and posteriorly using the bony prominences. So this is the anterior pelvis support. These are offset. They have an area for increased space for the abdomen, especially in an obese patient. So these are left or right, and they also are a small or a large. And this will accommodate the vast majority of the patients. There is an offset bar for the anterior pelvis, which is used primarily in justifying the patient anteriorly for those of you who do anterior approach hip surgery in the lateral position. The remainder of the set is very similar to the hipGRIP first edition. The bottom part of the case is basically the same parts as the first edition of the hipGRIP, and it's upright supports, small, medium, and 2 large. These are used for the posterior aspect of the pelvis, and then 2 supports, one in the front, one in the back, controls the rotation and the position of the upper patient. It's actually very, very important to control the chest, because if the chest is not controlled, it puts a torque on the lumbar spine and can change the position of the pelvis. There are systems that don't provide good support to the chest, and it actually is, I think, an unsound principle if you're going to stabilize the pelvis for hip surgery. The angle bars are all part of the bottom of the set. I think that it's very important to choose the supports you need for a particular patient, and either the nursing staff or you, the physician, set them out on a Mayo stand and assemble them before the patient even comes into the room, so that when your patient is anesthetized, there's minimal time between a patient coming into the operating room and you getting to do your surgery. There are what are called cover sets, which are just a cotton lycra fabric, which I think is important to put over the padded areas of the hipGRIP 2. This conducts the moisture away, helps prevent maceration of the skin, and actually protects the pads as well. A very inexpensive way to prolong the life of the pads. After the cover sets are applied, or even before, then you assemble the appropriate positioning device for your patient. The posterior chest is usually a short bar and a long upright. So anterior chest, usually the long upright, and either the medium or the long bar. In a small patient, it would be the long bar. In a medium patient, it would be the medium bar. And in morbidly obese patients, it may be the short bar. So, an anterior chest. The posterior pelvis usually is the short, sometimes the medium, but usually the short is most appropriate for the posterior pelvis, and always a short bar if you're going to justify the patient posteriorly. If you're doing an anterior approach and justifying the patient, the opposite side of the table would be a long one. We're going to demonstrate a right hip surgery in the lateral decubitus position, right hip up. So we have the right anterior pelvic support. In most patients, this is a long or a medium. We're going to demonstrate using the medium bar today. So when I'm ready for the surgery, I have these all set up and ready to go.